Module Overview. By the end of this module, you will grasp the historical development and global importance of rehabilitation, understand the multidisciplinary nature of rehab teams and their dynamics, define the role and scope of a Rehabilitation Support Worker, RSW, identify various rehabilitation settings and populations served, comprehend the stages of recovery and how they influence support delivery, understand the ethical, legal, and emotional foundations of rehab practice. 1.1 What is rehabilitation? Rehabilitation is a goal-oriented and time-limited process that enables individuals with impairments, injuries, or disabilities to reach and maintain their optimal functional independence. It covers physical, emotional, psychological, and social recovery, and often involves multidisciplinary care. The WHO defines rehabilitation as a set of interventions designed to optimize functioning and reduce disability in individuals with health conditions in interaction with their environment. Key dimensions of rehabilitation: restorative, helping a person regain prior functioning, e.g. walking post-surgery; compensatory, teaching adaptive strategies when full recovery isn't possible; preventative, minimizing risk of deterioration or complications, e.g. fall prevention; supportive, promoting psychosocial well-being during long-term care. 1.2 History and evolution of rehab services. Rehabilitation, once an informal aspect of post-surgical care, has evolved into a specialized interdisciplinary field. Key developments include WWI and WE. The need to reintegrate injured soldiers drove formalized rehab efforts. Polio epidemics sparked early pediatric physical therapy efforts. Disability rights movement advocated for accessible, inclusive rehabilitation services. Rehabilitation 2030, WHO, advocates for integrated, community-based, and accessible rehab globally. 1.3 The Rehabilitation Team, interdisciplinary collaboration. Rehabilitation depends on team-based care, where each professional brings a unique lens to treatment. Support workers must know their roles and understand others to collaborate effectively. Common team members: physiotherapist, PT, mobility, exercise, posture, occupational therapist, OT, daily living tasks, hand functions, cognition, speech and language therapist, SLT, communication, swallowing clinical psychologist, emotional recovery, trauma, behavior, social worker, housing, insurance, social support, nurse, medication, wound care, hygiene, rehabilitation, support worker, assist, motivate, observe, record. 1.4 Scope of practice for rehabilitation support workers, RSWs. An RSW assists licensed professionals and serves as a vital bridge between the client and clinical team. Their role includes supporting mobility and transfers, aiding with exercises prescribed by therapists, encouraging independence in ADLs, bathing, dressing, toileting, documenting patient progress and concerns, ensuring safety and preventing injuries, providing emotional encouragement and promoting self-esteem, using assistive devices properly, participating in care planning discussions within limits. Note: RSWs do not diagnose, prescribe, or make clinical decisions. 1.5 Rehab settings and populations. Support workers must understand the diverse environments in which rehab takes place, setting common clients: hospitals, acute, post-surgery, trauma, stroke, outpatient clinics, orthopedic, neurological follow-ups, rehab hospitals, intensive, short-term multidisciplinary nursing homes, elderly, chronic diseases, dementia, community homes, disabilities, pediatric, mental health, home-based rehab, frail elderly, rural clients. Post-op rehab support workers must adapt communication, care and assistance style based on setting and population. 1.6 Recovery stages and the role of support workers. Understanding the patient's recovery journey helps the RSW tailor care to their emotional and physical state. 4 recovery stages: acute phase, high medical needs, patient is weak dependent; subacute phase, therapy begins, mobility improves, mood shifts; rehabilitation phase, intensive therapy, goals set, progress visible; maintenance long-term phase, managing chronic impairments, lifestyle adaptation. At each stage, the RSW must offer the right blend of motivation, observation, and empathy. 1.7 Ethical Principles and Empathy in Rehab Support. Rehabilitation care must be rooted in ethics and empathy. Key principles include autonomy, support the patient's right to make choices; dignity, preserve privacy and self-respect during care; non-maleficence, avoid causing harm; beneficence, do good, promote well-being; justice, treat all clients fairly. Rehabilitation is emotionally intense. RSWs must be patient, respectful, and uplifting, even when patients are frustrated, nonverbal, or depressed. 1.8 Legal and Safety Obligations. Rehab support workers must uphold laws like GDPR Europe, HIPAA USA, Data Privacy Health and Safety at Work Act UK, mandatory reporting laws for abuse, neglect, infection control protocols, incident documentation policies. Failure to comply can risk the patient's life and the worker's career. Module 1 Summary. Rehab support is multifaceted and human-centered. RSWs are essential allies in helping patients regain independence. Ethical, legal, and emotional understanding is as critical as physical tasks. Strong communication, empathy, and teamwork skills are non-negotiable. The field is diverse, growing globally, and full of opportunities for meaningful impact. Click the button to subscribe.